So welcome to the launch of Women in Global Health Australia, the Australian chapter of Women in Global Health. My name is Dr. Margie Danchin. I'm a paediatrician and immunisation researcher at the Royal Children's Hospital, Murdoch Children's Research Institute and the University of Melbourne. And I'm going to be facilitating the discussion today with an extraordinary group of women that I'm very humbled to be a part of. So like everyone joining today, I'm extremely passionate about global health and women in global health. But before we get started, in the spirit of reconciliation, I'd like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community, and pay our respect to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. As we're all aware, this is NAIDOC Week, and the theme this year is Healing Country. Healing Country is about connection to country and stronger measures to recognise, protect and maintain Aboriginal and Torres Strait Islander culture and heritage, including protection of land, hills, waterways and stories. I would also like to acknowledge that the Aboriginal and Torres Strait Islander peoples have occupied and cared for this land for over 65,000 years. I think we've all seen beautiful artwork this week and ceremonies and video messages, meetings and celebrations for NAIDOC Week. And later today, we'll also have the opportunity to hear from two outstanding Indigenous women leaders in health, Jacinta Elston and Jackie Hughes, the co-chairs of the Aboriginal and Torres Strait Islander Committee of Women in Global Health in Australia. So first, just to tell you a little bit about Women in Global Health, it is a voluntary organisation that has been established to address gender inequity in global health leadership. Because of course, we're all aware that women form more than 75% of the healthcare workforce and are the main drivers in healthcare delivery globally and are powerful agents of change. But a significant gender gap in health leadership remains and continues to weaken global health. So it's clear that we need gender transformative leadership driven by gender equality and women's rights, and that is what we're going to be discussing today. But before we move into the launch of Women in Global Health Australia, we're going to have a conversation with Professor Fiona Stanley. And I would encourage you as I'm talking with Fiona to put questions or comments into the chat, because after about 20 minutes or so, we'd love to reach out to you and talk about some of your comments and questions. So Fiona has asked for a brief introduction, but Professor Fiona Stanley AC is the founding director and patron of the Telethon Kids Institute. She trained in maternal and child health epidemiology and public health and has spent her career researching the major causes of childhood illnesses such as birth defects. And for her research on behalf of Australia's children and Aboriginal social justice, she was named Australian of the Year in 2003. In 2004, she was honoured as a National Living Treasure by the National Trust. And in 2006, she was made a UNICEF Ambassador for Early Childhood Development. She's passionate and a knowledgeable advocate about Aboriginal and Torres Strait Islander health leadership and gender equality. So Fiona, I will stop there. I know you get embarrassed by long introductions, but it is an absolute pleasure and honour to have you with us today. But first, I would like to take you back, if that's okay. In medical school, I understand you were one of 6 women in the class of 100 at the University of Western Australia. Can you talk a little bit about that? And did you notice at that time that women were treated differently from men?
Can I just say at the beginning, as the politicians say, I hope that they say, can I just say? But I just want to say how wonderful it is that you've got this launch today. I feel so excited about it, even though I feel a bit of a fraud that I'm not in global health, but we've discussed that. And I also want to acknowledge that I'm on Noongar Budja, and I acknowledge all of the reasons why we want to acknowledge country, but also healing country is a very beautiful word because it's not just about healing the country, it's about country healing us. And, you know, I just referred to the Northern Territory legislation where instead of putting more kids in Dondale, which is what should have happened, what should not have happened, we should be putting kids on country. but instead that horrible Northern Territory legislation has just come in, which is devastating. So, you know, healing country is a beautiful word because it's both. Yeah, thank you. Okay, yes, well, I was this sort of odd woman in this group of men. And of course, it was totally misogynist. It was huge, but we didn't even know how to spell misogyny. We just took it for granted that, you know, we were so few women and that was it. I mean, this is the 1960s, guys. I'm very old, okay. And so I just wanted to fit in. That was, you know, like you know, you can't ask me that kind of question. I just wanted to be part of the medical school and not stick out and be unusual. And so we ignored it. We ignored the fact that we were this group of women. I just want to say that sort of played out across my career, that I played the game. You know, I really played the game. And I had a huge advantage being a woman eventually, because I was in that group in the 80s where they wanted women on committees. So there I was on the HIV/AIDS Council. I was chair of the Australian Institute of Health and Welfare when I was only about 14, it seemed to me. But anyway, you know, I made the most of this. So, and definitely we were treated differently. And yes, we were disparaged. And yes, we were, I didn't have any sexual harassment. I don't think that probably, you know, I was good enough for that, or, you know, didn't have the right legs or something. I don't know. But anyway, but I certainly had a lot of misogyny. But as I said, we just didn't even know how to
move forward with it. And then
Absolutely.
Fiona, so moving forward a little bit, as a medical student, you spent time in Papua New Guinea, and then you were also running the Aboriginal Health Clinic at Perth Children's Hospital early in your career. How did those experiences shape your ideas about improving health outcomes?
Oh, hugely. Actually, as a second-year medical student, I went up as an unqualified nursing aide to Port Hedland and did a whole lot of flying doctor work around the northwest. So that was the first time I'd really been in an Aboriginal community. And then we did another huge tour of Aboriginal communities when I was a young doctor, when I was running that clinic. And being in PNG and just seeing, I guess what really it showed me, although I didn't know at the time because I hadn't studied my epidemiology then, was it was about the social determinants of health.
Yeah.
So there I was being sort of trained by the Children's Hospital to be the next paediatric neurologist. And I just thought, no, I can't do this. But it was really the Aboriginal situation that made me think about public health.
Yeah.
It made me think that, why are these kids getting sick? Well, it's obvious why they're getting sick. They're in the most appalling circumstances, and we treat them in hospital as medical miracles and plonk them back into the very communities that caused the problems in the first place. So I slowly educated myself that really I think I was the only person in the whole world who's turned down a registrar position at the Royal Melbourne Children's to go off and get trained in public health in one of the best places in the world. So absolutely committed then to getting the best data, setting up registers, setting up data linkage, because that's what really drove my passion. I love data, and I just love the fact that we could perhaps do something to prevent many kids getting illnesses and problems. And of course, that's just gone bigger and bigger because, it's the social and economic and extreme capitalist environment now that's driving a lot of those health outcomes across the globe.
Fiona, just coming forward a little bit now, this week during NAIDOC Week, you hosted the Indigenous Health and Medical Research webinar for the Australian Academy of Science and had a wonderful conversation with Professor James Ward and Professor Nairi Brown. And just reflecting on what you've just said then, I'd like to ask you to comment on the most outstanding response that we've seen from the Aboriginal and Torres Strait Islander communities with regards to COVID, and just some of your thoughts around that, because it's just the most extraordinary success story.
Thank you, Margie. I'm still getting goosebumps. Even just mentioning James's name and Nairi's name just gives me goosebumps. Okay, I think probably you might all know this, but because of H1N1 and the experience there when Aboriginal people didn't have a place at the table, it was devastating. 5 times the number of cases, 10 times the number of admissions, and 12 times the number of deaths in Aboriginal communities for H1N1. So as soon as there was a thought of a pandemic, the Aboriginal leadership, the public health and NATCHO and leadership at every level, from national right down to local community level, swung into action with the most sophisticated, evidence-based, scientifically rigorous preventive strategies, management strategies, You know, they lobbied to get the communities closed. But at every level they did this. Partnerships set up with every state and territory government bureaucracy, demanding what they knew, because of their lived experience, needed to happen to prevent this pandemic affecting. Okay, the outcome, we would have expected about 1,000 cases nationwide because of the percentage of the population and their increased risk status and the way they live and so on. There were 150 cases. That is a six-fold difference. We got COVID 6 times more than our First Nations. It's unbelievable. 15% hospitalisations, 1 person in intensive care, no deaths, no cases in remote communities, and no cases after the Black Lives Matter. Okay, so what does this mean for now and for post-COVID and for Aboriginal health? Well, you know about the Uluru Statement from the Heart, demanding a voice. If we do not give Aboriginal people the power to run their own show, we are so stupid, because this is the best evidence ever, and we've got lots more evidence to show that people who know what to do, who are the people, are so successful. I mean, they've saved millions. If you just look at it from a cost-effective thing, they will save us millions of dollars of wasted, useless, Canberra-centric or capital city-centric health and welfare things. That's why I'm so anguished about this Northern Territory legislation that's just come in, because, you know, it is now very clear. So we have very good evidence now. So it's really up to all of us, and I think paediatricians are very powerful, to lobby everyone we can at every state and territory to say, support the Aboriginal-led responses to everything. I go into any community, and they're sort of dysfunctional community. Even in those communities where they look as though it's desperate, there are people there who have the solutions, and they're the ones who need to be funded. There's a huge white bureaucracy that is destroying this, and we have got now this opportunity. Sorry, can I have time to read this beautiful quote or not?
Yes, please do. I just think absolutely, you know, just...
I hope so. Okay. This is from Garawa Yunupingu, who signed the Uluru Statement and is part of the constitutional reform process. What Aboriginal people ask is that the modern world now makes the sacrifices necessary to give us a real future, to relax its grip on us, to let us breathe, to let us be free of the determined control exerted on us to make us like you. And you should take that a step further and recognise us for who we are and not who you want us to be. Let us be who we are, Aboriginal people in a modern world, and be proud of us. Acknowledge that we have survived the worst that the past has thrown at us. And we are here with our songs, our ceremonies, our land, our languages, and our people, our full identity. What a gift this is we can give you if you to choose to accept us in a meaningful way.
Ah, beautiful. Absolutely.
So beautiful. And yeah, I just feel we have such an amazing opportunity. We are, you know, when I wrote these articles with James and Marcia Langton and Sandy and Dan and so on, and James Ward, it is so important that we get this message out, and because it will change. But you know, when you think of us compared with the rest of the world, Navajos, Brazil, you know, First Nations in Canada, it is a remarkable achievement.
It is a remarkable achievement, and you know, I think really speaks to, as you're saying, what happens when Indigenous leaders, community leaders, researchers are in that front driver's seat, as James said. You know, and the power of community and elders.
The power of the elders. I mean, God, the elders. I'm on this wonderful Nankgira in Western Australia, this wonderful health and wellbeing group run by Rhonda Marriott. The elders came the other day. I had to then, after they questioned me, I had to go on internationally to find out how Aboriginal race is recorded on all the international data sets. I mean, because the elders were questioning how well is it recorded? How good are your data? I'm thinking, God.
And Fiona, just extending from this, you've also written a lot about reframing the way that we think about closing the gap, and that the measures need to change. Can you expand a little bit on that?
God, Margie, you've done your homework. Yeah, well, it seems to me very, very much, and again, I've written this article for the conversation with the Aboriginal scholars that I work with, that comparing one Aboriginal population, which there isn't, with one non-Indigenous population, non-Indigenous population, which there isn't, is always going to be useless. It's, you know, there are many Aboriginal populations, some of whom are doing very well and some of whom are not doing well. And it's that comparison which will guide, because you want to know which Aboriginal kids or which Aboriginal young people, which Aboriginal families are actually doing well, who doesn't get into detention and why. That's what's going to guide prevention. Now, of course, it is helpful to have a gap analysis because it's a lobbying thing and, you know, all of that, and I accept that. But for actual analysis where you can really get into the pathways that will improve outcomes, you want to know what improves outcomes. So that's the message I've made.
And to use a gain frame, as you wrote about, you know, frame the advances positively rather than always using that loss frame, I think.
Yeah, and that improves the self-esteem in Aboriginal communities. We know that that people who feel good about what's happening, of course, their self-esteem goes up, and it actually can have, you can look at a pathway to suicide prevention like that. But the other thing we didn't mention on the webinar was the Indigenous data sovereignty movement, which people could look up. I haven't got time to go into it now, but boy, I mean, you can think all these things that these Aboriginal scholars are doing now is just brilliant.
Yeah, no, I totally agree. So Fiona, now I'd also like to talk about something close to my heart as well, which is mentoring programs. And you've sort of recently challenged traditional mentoring programs with an article that you wrote with Teresa Wozniak. And I've been reading about the Catalyse mentoring program, which I know that you've contributed to the development of. And from what I understand, it's really a dual mentorship model where the female mentee is matched with an academic mentor and a corporate sector mentor, which I just think is brilliant. I wonder if you'd just talk to us a little bit about that.
Well, it's Teresa who set that up, and I'm just a part of it, but she set the whole thing up, and it's actually been terrific because it's actually what we're talking about here, and why I wrote the article with her is that because I'm doing group mentoring, which has the same impact. Because if you just mentor one-on-one, you make the women feel better about the situation that they're in and perhaps better able to cope with it, but you're not changing the situation. You're not changing the really bullying misogyny that is so incredible. I'm amazed at how widespread this is now. So you have this sort of business mentor, and they say, why are you not getting together and changing the system?
Yeah.
And in my group, I have some 7 or 8 women on the whole. I have the odd man, but I mentor now 4 or 5 groups. And what's happened is they mentor each other, but it empowers them to change the system. And that would never have happened if we were doing one-on-one. So I think, you know, you can mentor one-on-one till the cows come home, but it's still going to help you, but it's not going to change what we need to change, which is a very unfair system of males not even realising how detrimental their attitudes and conversations often are to women. And some of it's blatantly getting in the way. So
I think having that group mentoring model is brilliant. And I note in the chat, Alison Hempenstall said that she was part of the Catalyse mentoring program. So it might be great to hear from her, but also tapping into the skills of our corporate sector leaders in terms of strategy and leadership and interpersonal skills, I think can also provide huge benefit.
Really important. I mean, every skill that we can get to be better and to better handle. You see, what's so fabulous about women is on the whole, they don't have, what I love about working with women is they don't have this ego that we have to keep on walking around and stroking and everything. They just want to get on and do the bloody stuff. I'm swearing more now that I'm older. And it's just so great because that's really what's going to make a big difference. And, you know, if you want to succeed, don't worry about yourself so much. You know, really worry about the issues and how to better them. And that's what you want to do. But if things are getting in the way, you have to change the system that won't let you succeed. So ambition is great. Having an ego is great as long as it fits with what the community needs and the society needs and the science needs. Whereas a lot of the other egos, male egos, are just about them and their success. We need to change the way we measure success as well. But anyway.
Well, that's true. Do you want to comment on that? How do you think we should measure success?
Well, there are a whole lot of ways which women work, which are very not particularly well acknowledged in the track record system. And we were talking about this on the webinar too, the sort of more holistic ways of doing science and collaborating and, you know, having a longer time period to implement things which really work. And that's not the system. And I think that kind of female thinking about causal pathways and the understandings of these social issues, and particularly it relates to the Aboriginal agenda, where you've got this complex intergenerational stuff and a 3-year randomised controlled trial STD prevention is just not going to hack it.
No.
So I think those kinds, I mean, they're not particularly feminine. They're just sort of, women tend to think more like that. But we need to think of the ways, and rewarding success, of course, really about the success we are as our other facets of.
And James Ward also spoke about that, Fiona, a bit too, in terms of longer term funding options for Indigenous researchers as well, and transdisciplinary models. Yep, and moving beyond single interventions. I think there are also metrics that we can think about for success. But in terms of traditional ideas about leadership, given we're talking about women in global health leadership, I wonder if you could share with us, what do you think we should be asking of our leaders now?
Yeah.
What do you think we're looking for in leadership?
Really important. Just to finish that bit about the mentoring and stuff, what we did as a group of women of my age is we broke the glass ceiling. What we didn't do is change the culture. And that's what we now have to do.
Yeah.
So I'm sort of wondering what traditional ways of leadership were, but I guess it's, I'm the boss, you do what I say.
Yeah.
Kind of approaches. But we have to change that drastically, because what's been so exciting about my leadership is exactly the opposite. So the way that I led, which, I'm not saying that I'm the great role model, but what you do is you surround yourself with the best people. See, I'm not that particularly bright. I just am very good at getting people around me and helping them do great stuff. I know I can see what's good science and stuff, but I'm not as bright as all the people that I've managed to recruit around me. Then what you do is you enhance their capacity. What you do is there are too many people who get worried, by having, they need a bunch of sycophants around them.
Yeah.
It's the opposite that you need. You need to have a bunch of people who are going to criticise you at every step of the way. So you put up a vision and they pull it apart, because that's going to make it really great. And if you have the best people and mentor them up and grow them, because once you're the leader, you don't need to worry about your track record anymore. You don't need to be first author. You don't need to be CIA. You don't need to go to all the big international meetings and give keynotes, but they do. And that's the way. And so what you're then doing as you're growing that capacity for your organisation or for your team or whatever, you're then putting in a succession plan that's going to mean that it'll be really better than ever. And it's so much more fun. Like I looked upon my leadership, we were all friends. We all became best friends. And I think that's a very female thing. It was like family. I used to wander around the institute and talk to the wash-up ladies and the lab people and everything. And they were all amazed that I knew their families and, but, that's just what we do, don't we? It's just like, it's that warmth. And I loved it because, I felt, that they're all my friends, really. So, but I think
I love that concept, Fiona. Yeah, your concept of leadership, though, of bringing people with you and working on a common goal and a common purpose, rather than this top-down leadership that I think we're witnessing a lot of our current leaders.
Margie, it was usually the other way. It was their ideas, darling, and I just enabled them to happen. Yeah. I had the odd idea myself, of course, but on the whole, you get these great people, and they come up. I mean, I said, "What's the next most important question we need to address?" Whoa, off it went. It was great.
Yeah, no, absolutely. No, that's brilliant. All right. Well, look, Fiona, I think we've got some fabulous comments in the chat and some questions. Okay. So I think we might move to some of those now. I wonder if, who was it? Alison, do you want to talk a little bit about the Catalyse mentoring program? Gus, is Alison able to come off mute and comment on her experience of the mentoring program? I hope so. Or do I have to read all the comments? It'd be great if people could share their ideas. Maybe not.
Why don't you share her comments if you can?
Yeah, so she just said that she was part of the Catalyse mentoring program for women in science and medicine last year, and it was fabulous. And I was really quite keen to hear of her experience, but it doesn't sound like she can come off. It says Gus is trying to get her on the mic, so maybe we can wait for a minute. But there have been some fantastic comments, Fiona. Really, I think people talking about the fact that we need to remove ego from leadership, and much more around authenticity rather than ego. Magdalena has made a fabulous comment. Leadership of service, focusing on the group and its impact and the reasons. And what do you do for the big picture, facilitate and uplift those on your team? So some fantastic comments. I'm just searching here.
Really actually important. I love this bit that someone said, Claire News said that a leader is someone who carries water so everyone else can get on with their jobs. But it's very important for a leader to be well read, you know, and having a finger on the pulse of what's happening in society. And so there is an importance of going beyond your discipline to find out. So I think that's very important for a leader to be a well-read, well-educated leader, to be able to say to the group, look, I read this article in the New Yorker, or, you know, and it was really interesting about this aspect. And yeah, and it also makes your life more interesting.
Yeah,
and ego isn't bad. It's just, it's got to be, yes, it's got to be for what is important rather than for you. So it's an ego, if you like, or ambition for the area that you're working in and for the vision you want to push.
Yeah, I agree.
Rather than for yourself.
Fiona, I love this comment from Camille Rains Greenow. I hope I pronounced that correctly, but she says, yes, women work in different ways and it's not captured in the usual metrics. Would you agree with that?
Absolutely, absolutely. So I think that's what we have to change. You see, I broke the glass ceiling, guys, but I can't do all this. You've got to do this now. Yeah, I love it. Someone said, can you get a New Yorker as a tax deduction?
Fiona, Lindsay Morton has put in a question. She says, Fiona, when you mentioned you helped break the glass ceiling, but culture still needs to change, do you have thoughts on what we can do to start changing the culture?
Well, yeah, because I feel bad that I played the game. You know, I went along with the male ways of doing things. And I just think it's really important that we now challenge that. And that has to be done collectively. It's very difficult for you as a younger woman, perhaps you don't feel you have a lot of power, but collectively you have huge power. So one of the things you can do is to start, I don't know if you're in institutions, organisations, universities, whatever, start getting data on stuff. Who gets the philanthropic funding and why? Who has administrative support to help them with their research activities? Sometimes in my group that I've been mentoring, they're made the chair of this new initiative within an institute or a university, but given absolutely no support to do it. So there's no administrative support. So that means their research, again, is put to the bottom of the pile. So it looks as though the institution is really supporting these women, but it's actually making them weaker. So there are a whole lot of things in terms of the structure of the organisation that will change the culture. And it's about rewarding women with the kinds of things that men have been rewarded with for a long time. But you do need to have support. You need to have the ability to have a voice. And that doesn't, you know, everyone says, oh, the solution to all of this is just have more women on committees and selection panels. Yeah, but that again is really challenging because, you know, you're asked to do a million things. Poor First Nations who have to do get asked to do everything because they need a First Nations person on it. So you need to support each other with that to get those selection committees. And that's true. We do need to have women on selection committees, but you can't flog women to death to do all these things without getting proper administrative support. So I think that's a really big one, but you do need to have a voice. The other thing, I saw a proposal for getting more women into STEM, and it was all about, you know, because as you get through the age range and your seniority range, all women fall off. And of course, it's child room. It wasn't mentioned throughout the whole document. And what we need is a really good, I mean, didn't COVID expose privatising essential welfare services? My God, we need to have really good childcare. And that has to be institutionally supported, as has to be an environment where, in fact, you can go home if your kids are sick. And boy, we can work from home. We're so good at it now.
Yeah.
I mean, there is a silver lining to COVID.
Yeah, I was going to say COVID has actually had some benefits for women, being able to be more flexible and working from home. Although I think the impact on women with preschool and younger children has been quite profound in terms of trying to manage working from home, you know, research, academia, as well as managing young kids.
Well,
But Fiona,
I just felt very bad, maternal guilt. I was racked with it, and I absolutely committed myself that no woman that I ever mentored after this would ever have the same thing. And of course, everybody has. My daughters have, everyone. So I failed miserably.
No, you haven't failed. I think it's just an ongoing journey, isn't it?
But it is such an anguishing issue. Here we're researching the developmental pathways. We know that maternal and paternal love and care is so important, and you know, it's a big one. It's still a very big one, and we're not doing well. We have to look at Sweden.
Yes, yes. Sweden does have a lot of lessons for us, I think, in terms of.
If I could be very critical, I don't think this coalition government understands anything about developmental pathways. They don't understand anything about anything, it seems to me. But anyway.
Fiona, just shifting back to the extraordinary, inspiring Aboriginal and Torres Strait Islander response to the pandemic, Louise Bauer has asked that we're all aware of the Delta variant impact, which is obviously a lot more transmissible and infectious. And she wonders if we can expect the same good outcomes for Aboriginal people over the next year, and what might be needed to ensure that. Tricky question, but do you have any around that?
There are two issues there. One is vaccine rollout, and I don't know if you saw that Meningrida has a 70% vaccination rate.
I know, unbelievable.
Up in the Northern Territory.
So impressive. Yeah.
I mean, one of the Aboriginal people I'm mentoring is Robert James, who's up at Nullarbor, most gorgeous Aboriginal doctor up there. And he said, "Oh, just give us the power and we'll do it." So that is that message. I think if the Nacho and the communities can keep going with their commitments but they have to be supported. We must give them support because this strain is very scary.
Yeah.
So we really must keep supporting all of the ACCHOs and all of the other Aboriginal controlled NGOs that are helping the ACCHOs. So it's been and even right down to communities but the real issue is in the big metro areas where most Aboriginal people live. And that's why we've got to support those ACCHOs. And if there are, even to this, and there's been the wonderful group of Aboriginal scholars who've put out this blueprint, the task force that's put out the blueprint for post-COVID. We need to read that, and we need to put every single recommendation in place, which includes things like homelessness, home housing, looking after the homeless, and because it's the metro areas that are going to be the risk places for our First Nations. It's not the remote communities.
And as you say, the challenge will be around getting high vaccine coverage, and certainly in the space that I work in around vaccine acceptance and confidence and uptake, I'm aware of a lot of conspiracy theories that are circulating in Indigenous communities. And I think, what that really comes back to is trust, isn't it? Trust around being able to communicate clearly. And have you been involved in some of the vaccine discussions with?
Yes, I mean, it's the power of the elders. That's why Meningrida's done so well. And in the Eastern Goldfields, Jeffrey Stokes, who's a religious pastor who could have said, no, let God do it. He's come out absolutely strongly supporting vaccination. So I think it's very, very important. The elders are a really amazing group of people, and I think we need to let them help us with this too. But we've just got to support the leadership. So please support the Aboriginal leadership. They are
power of community and elders. Absolutely
amazing.
Speaking about leadership, Fiona, there was a question from Sonia Brockington, and she says, my team has been running a humanitarian leadership program for a number of years.
Wow.
And we talk about authentic leadership amongst other models, but ultimately leadership at every level. And this challenged the cultural position of many of our students who are from all over the world. In your experience, how have you seen these cultural or social views challenged or changed that can see men and women both effective leaders? And what is the role of formal global health education programs in this change? A meaty question.
Wow, it sounds as though we should be asking her.
Yeah,
that. I'd love to know more. Oh, I'd love to know more about that.
Sonia, maybe you can type more for us, but it does sound like an incredible program.
Does, and I think I don't think we've succeeded in getting that changes in the males yet. but I would love to. I mean, I think that sounds very much more aggressive, and I mean that in a nice way. You know, we have to be aggressively strong about the kinds of things we want changed, and that everyone talks about changing that culture. But until we do that, we are not going to get the best healthcare system. We are not going to get the best research. We are not going to get, I mean, it really is that important. And that's why that First Nations response to the pandemic has so clearly shown that. And, you know, because what they did was just said, we don't care about our own selves. We just want this to make a difference. And that's what women are on the whole are like. So it really is important, but I haven't got the answers to that. It looks as though she has.
Beautiful question. Now, I might finish the last question to you as a mixture of a question from Sarath Ranganathan and Julie Bynes. And Fiona, just to finish, can you tell us about the courage that is required for a woman to be an authentic leader to herself? And also, what advice might you give your younger self if you were starting out in your career now?
Well, it would be to have that courage, I must say. I was just so, I was so frightened. I just felt I had to try and impress people, that I wasn't really good enough. I felt I was faking a lot of it at the time. You know, you really don't have a lot of courage in yourself. But the thing that really makes the difference is the collective. And so it isn't about singular leadership. It really isn't. And I think authentic leadership is acknowledging that you're just one small little person. I mean, you know, you've got this training and that training and you've had this experience, but really it's only going to be really powerful if you collectively work. So I think it's talking about leaders and the leaders, you know, that if it hadn't been for all the leaders that I recruited at the Institute, and all of them were absolutely brilliant, it wouldn't have happened. And I think it is about that. And my younger self would be, just have a bit more confidence in yourself, you stupid little twit.
Have a go, get out there. Well, you've done it. Honestly, Fiona, you have made such an extraordinary contribution, and I hope we'll share the comments. There's some beautiful comments that you should read later in terms of what an inspiration you've been for so many. And so thank you so much for this conversation and for this discussion and for your wisdom and insights. It's really, I feel like we could talk all day. But we're now going to move to the next part of the program, which is to welcome Dr. Roopa Dhatt to a conversation and to give us a brief presentation. Roopa is a passionate advocate for gender equality in global health and a leading voice in the movement to correct gender imbalance in global health leadership. Welcome, Roopa, today to the launch of the Australian Women in Global Health chapter.
Oh, so nice to be here with you. And yes.
And we're delighted there were no tech issues and that you could join okay. I'm going to give a little bit more of an introduction about you because you are quite extraordinary. So you co-founded the Women in Global Health in 2015 and are currently the executive director. And if I can just talk a little bit about the Women in Global Health movement, I think currently internationally it has over 50,000 supporters across 90 countries in about 25 separate affiliated chapters with really amazing representation across low and middle income countries. And so, we really welcome your comments today. I think you're going to give us a brief presentation, and then I also invite people, please, as Roopa is speaking, to type questions and comments into the chat.
Great. Well, Margie, it's again so nice to be with all of you. And I think I feel so inspired after listening to Fiona. I think just your words of collective action, that's exactly the reasons why we started Women in Global Health. And we became a movement, a collective group first, and we became an organization several years later. And that's why, the sort of, community we have around the world is just so energizing. It keeps me energized. And it's so wonderful to know now that there is a growing community in Australia that's going to be part of the global movement. Such rich learning, that questions about intersectionality, putting power into the hands of communities, really looking around and who's in the room, who isn't, who has resources, these power and privilege questions. I think the earlier comments really set the scene, and I'm going to turn to a PowerPoint. I don't want to, but I think it'll be just nice to kind of demonstrate a little bit about the core principles of what is women in global health, what is it that we do, and some of our policy priorities, just to introduce you a little bit to what's been happening around the world with other chapters and what we've been focusing on as a global team.
Well, Roopa, while you're sharing that, I also meant to say at the start, of course, and to congratulate you on the launch of the Generation Equality Forum last week in Paris, which was obviously a global gathering for gender equality, and the launch of the Global Acceleration Plan for Gender Equality, and raising awareness around the Gender Equal Health and Care Workforce Initiative. So I'm sure you're going to maybe cover a little bit of that, but really inspirational. And we'd love to talk a bit more about that in a minute.
Great, definitely. That's part of, right, as I say, hot off the press, and I'm going to be covering that in just a second. So the first part, Marjorie, you already covered for me, which is, it's sharing a little bit about the scope of like women in global health. We are a global network. Our tagline is challenging power and privilege for gender equity and health. We were founded in 2015. Our movement continues to grow. We have about 50,000 supporters, 25 official chapters around the world, and we're actually projected to double in next year. We have over 37 communities around the world that want to join the movement and become a chapter. Our team is based throughout the world, so I just want to acknowledge it's not just me, but it is a team that is spread throughout the world that supports the global work and really supports our chapters. One person to know is Mwende Mua, who is based in Kenya, and she's our chapter development manager. And our global movement, this just shows where we have chapters, where they're currently incubating, and where they're in the launch. And I'm so delighted to show Australia here in that pre-launch phase, and it'll be launched in hours from now. Our values, we call ourselves a global movement, and that means that we are a network of women and allies from all geographies. We're fighting for equity in global health. We're a platform for all voices, so we really make an effort to make sure those that are less visible get opportunities. We see ourselves as a catalytic force, so we go to places where the conversation isn't yet happening on gender equality, looking to transform and create enabling environments. We're also a strategic disruptor and really look to do more systems and structures change and really challenging the norms. Those were some of the points that came up in the earlier talk with Fiona. When we look at the global health leadership pyramid, and this is one of the first things that Women in Global Health actually did, is collect data. We began by counting how many women were heading chief delegates at the World Health Assembly, which takes place in Geneva, hosted by the World Health Organization. And the first year we did the count, it was 23%. And quickly we realized just doing that one powerful data count, it opened up a Pandora's box of really all the data that was missing on, let's go ahead and stack and create a pyramid of what is the leadership pyramid in global health. So if you take a look at the baseline of health and the care sector, 90% of the health and care workers end up being women. And when you start going into looking at policymakers, those numbers are usually around 25%. They don't shift very much. Start looking into academia, those numbers are usually around, again, 20 to 30% range. And then when you look at the private sector, less than 5% of Fortune 500 companies are led by women, particularly healthcare companies. And so this is a pyramid that we revise every 1 to 2 years, just to kind of say this is a snapshot. And I feel disappointed, but at the same time energized that we have work to do. But this pyramid has not shifted in the last 5 years. We have seen changes in particular organizations, such as the World Health Organization made a commitment to gender parity with the new when the new Director General was elected, and that was when we saw a shift in senior leadership. But we know that overall sector-wide, these numbers are still showing us there's a grim picture, and we still need to continue to push for gender parity. Our theory of change is we mobilize together as a collective movement. We advocate for change, and we do this by using evidence and using best practices and policies. We garner commitments from individual leaders, but especially organizational leaders, and then we hold them to account by reminding them of the commitments that they've made and the progress that still remains. We look at issues deeper than parity. For us, it's about getting to gender transformative, and I'll spare the details of theory, but for us, why we pick gender transformatives is because it's going to the root drivers of gender inequities, and it is about also fostering progressive changes in power relations between genders and applies a intersectionality lens. We've done our own definition of gender transformative leadership that builds on transformative leadership approaches. And what I want to highlight here is that it's a work in progress. It's progressive realization, and we believe that if we truly all practice gender transformative leadership individually, collectively, in our organizations and society, we'll have better health equity. We've had lots of exciting projects in 2020, and why I wanted to bring our slide up for 2020 is that we did a really big campaign on COVID-19, which we called COVID 50/50, a gender responsive approach to health security, and the government of Australia made a commitment to that particular campaign, and they continue to be engaged in pushing gender responsive approaches in their global health diplomacy work. So hoping there'll be more connections with this chapter and the government, and a relationship that keeps pushing the needle. We host a partnership with WHO on health workforce, where we do technical research, and it's the Gender Equity Hub, and we invite all of our chapter members to join this hub that are keen to, again, do research, particularly looking at the health and care sector. If you want to learn more about our campaign on COVID-19, it's still active and it's still a key discussion point in global health. We're still fighting the pandemic, as conversations earlier were alluding to vaccines, and we know that this pandemic is far from over and there's lots of issues of equity. So for us, our campaign continues to bring visibility to women's roles, being gender responsive, and some of the gender aspects of the COVID-19. In the past year itself, we've had some pretty big milestone achievements. We now have a formal relationship with the World Health Organization. We have a memorandum of understanding that we signed on International Women's Day. Our language has been adopted into the World Health Assembly last year in the COVID-19 resolution, and hot off the press from this year, 2 resolutions mention our Gender Equal Healthcare Workforce Initiative. And I can go on and on about the impact of the global network collectively, but just showing you a glimpse of some of our achievements. We've partnered with over 200 partners. We use a partnership model to advance our work. So this is a value that many of our chapters also continue to practice at the national level. 2019, we focused on looking at the opportunity of the Generation Equality Forum. If you're not familiar with that forum, it is the point in time where it's been 26 years since the original Beijing Conference for Women that took place in 1995. That was the last time global leaders came together to really look at what action platforms needed to be set in place to put women's rights and gender equality and women's empowerment. It's taken 26 years for us to get back again to reevaluate. And while there's been progress, one realization is that not enough has been achieved, and we really need to start approaching things differently. And we need to start not only talking about rights, but looking at issues of power and getting power into the hands of women from all backgrounds. We also look at the fact that it is the year of the health and care workers. It was announced in November of last year, and last year was the year of the nurse and midwifery. So 2 years back to back on the health workforce. So that is also what inspired us to launch the Gender Equal Health and Care Workforce Initiative. And I'll be covering that in a moment. So this initiative is in partnership with the government of France, World Health Organization, and Women in Global Health. We announced it earlier this year, but at Generation Equality Forum, we had a moment of where announcements of commitments were made. The problem, all these things, I'm sure you know quite well. We bring up the issues of leadership. Women are in the health and care sector and lower status jobs. This sector, the health sector, has one of the widest gender pay gaps, 28% compared to others, which are 20%, high level of violence and sexual harassment. And this pandemic is putting stress on our health workers, and we can't afford to lose a single one. And so we're bringing the gender perspective into the conversation. Too often, conversations about the health and care workforce are gender blind, and we know that it's a gender driver which leads to pervasive inequities in the space. We are asking to have 4 pillars of action: enabling women to lead, making sure that we look at pay issues, fair pay, equal pay, living wages, looking at unpaid work that's happening and also counting the unpaid care work that's happening at home. Protecting women, so calling for a ratification of ILO 190 and decent and safe work, making sure all healthcare workers have access to PPE, vaccines, and are supported in the ways that they're asking to. You can learn more about the initiative and what different ways we're asking to drive commitments. There's a lot of details in the slide, and I'll make sure that this is shared with the team at Women in Global Health Australia. We make a case that there's a triple gender dividend when we do this. There's a health return, a gender return, a development return. This is the only way we'll achieve universal health coverage. Gender, when women have formal jobs, enter leadership, they're given more income and decision-making power, and that transforms gender equality. And there's a development dividend for every formal job that's created in the health sector. It fuels additional jobs, and that leads to achieving the broader sustainable development goal agenda. This messaging resonates with a lot of governments, especially when they are looking for investments that have a return. So this is one way that we've been effective in communicating. Now turning to Act for Equal, so coming straight from Paris, I was there just last week. It was the first global conference that I've been to during the pandemic, and I have to say it really felt very odd to get on the plane, cross the continent, see people not on a screen. At the same time, it was just also very energizing, and it was really nice to be able to, meet and connect face to face. And the campaign for making commitments at the Generational Equality Forum was Act for Equal. I just wanted to share a little bit of the action there, and I wish each one of you could have been there in person, since the original conference had thousands of women traveling in trains, buses, ships, planes, camping out in Beijing. And while we weren't able to create that in person, a lot happened virtually, and Women in Global Health had over 200 delegates virtually engaging in the forum. And these are just some snapshots. I did have a chance to talk to many global leaders about women in global health and really make the case for why our movement, our network is valuable to transforming the space. The forum itself raised $40 billion of new investments for gender equality. That is a substantial amount, but as our senior fellow reminded me, she's been in this space for over 4 or 5 decades. That only amounts to $2 a woman per year. So it's not much money when you really factor it in of what kind of investments, or it's just amounts $2 per woman. It's not a lot of money that's actually going into gender equality if you look at it that way. And for our initiative, we received over 30 different commitments. These are still being fine-tuned, but we were really excited that our first commitments came from African countries, particularly Liberia was the first country, then Guinea-Bissau. We have fair geographical representation. We did invite the government of Australia. They have not come in yet with a commitment, but we hope to continue that discussion, and hopefully with all of you as part of the community. The US government also did come in with support, many multilaterals, and the type of commitments we're asking for them is not just to show support to the issue, not just a advocacy commitment, but really looking at their policies, their programming, and see how can they advance and push the needle. And our ask, which will be available to all of you, is we're still calling for commitments. We're still asking for this initiative to be amplified. So I invite all of you to also bring the initiative into your communities and bring the discussion of these issues forward, because I know from my own colleagues that are working in the health and care workforce in Australia that almost every aspect of this initiative is so relatable. And on that note, this is information. If you want to learn more about Gender Equal Healthcare Workforce Initiative, this is the contact email address, but you can always directly reach out to me too. And as I close the slide deck part, for Women in Global Health, wherever we go, we always remind everyone that it is a field with so many talented women, and why aren't there more represented in the highest levels of global health, and what can we do about it? We don't have a pipeline issue in the same way. There is talent out there, and it's time to really harness that talent and give power to women from all different backgrounds. On that note, I turn it back to you, Margie, and so excited to share Women in Global Health movement, and I'm here to answer any questions.
Thank you so much, Roopa. That was incredibly inspiring. And I meant to say at the start, you're actually a practicing internal medicine physician in Washington, DC. I have no idea when you have time to actually practice medicine with all this extraordinary advocacy. So congratulations on your work. I just wanted to comment on the commitment of over 40 billion made during the Generation Equality Forum. That must be the largest ever investment into gender equality. Is that right?
Yes, that is. And that was highly, highly celebrated. And some of the exciting things were that there were pockets of money that opened up into spaces that usually aren't. And I kind of went over that quite quickly, but there were portfolios of money for really feminist movements or women's leadership, which traditionally does not get much funding. But the net count is that there's at least $500 million put into that. The second issue, which usually does not get much funding, is the idea there was an action coalition on economic justice where women in global health also made a commitment through this initiative. There was commitments coming from the government of Canada and a few others to look at care work. And that includes formal care work, but also the care work we all do in our households and counting that aspect. Other topics that did get fair amount of funding was gender-based violence, and I know that's a quite a critical topic in the Australia context too. So we were thrilled to see that there was actually money and investment coming into that.
Yeah, and the other pillar was getting unpaid work recognised to reduce the gender pay gap as well. That was a key pillar, wasn't it?
Yes, that's definitely the one in Economic Justice Coalition, and counting the unpaid care work that's happening at home, and that is definitely pushing the needle, getting that recognition.
Roopa, brilliant. Thank you so much. Just a couple of questions that have come through in the chat. Louise Bauer has commented, she said, thanks Roopa, so very inspiring. Which countries are exemplars of best practice or good policies to support gender equality in global health? And can we learn from these, particularly low and middle income countries?
Excellent question. So the first thing I always say is when we share a theory of gender transformative leadership, what we like to point out is it's a constant work in progress and it is progressive realization. And why I point that out is usually we turn to our Nordic countries and say they've achieved gender equality. But I can tell you from the colleagues of chapters like Norway and Sweden, they can tell you clearly there's still a lot of work to be done. They're not represented in equal numbers in leadership. There's still lack of, a pay gap is also present at times. There's still a lot of gender-based violence. So, it's just a reminder that every society, even if you have the best government policies, transforming gender norms is work that happens over decades and centuries, and we have to keep at it or there'll be setbacks. But really turning to what's exciting happening in different parts of the world that I want to point out is, in the Africa continent, many different countries have almost overnight said, we're going to have 50-50 cabinets. We're going to start including language in our parliament to make sure at least 30% of our political leaders are women. So countries like Ethiopia, Rwanda is the one that most people go to, but even Guinea-Bissau has, started doing that. Kenya is also working on similar policies, and it's quite exciting to see that type of transformation and in some of these countries, it's clearly they have a lot of other issues going on. So I always want to say it's with realization. Every society has work to do when it comes to equity, rights, and power and privilege. But some of the countries that have, for the health and care workforce, really done well is Ethiopia has formalized their community health workers. They have done it with a gender lens so that women were still staying in the workforce. Too often when community health workers are receiving living wages, it becomes a male job, overnight as well. But Ethiopia was effective in keeping gender parity, and it's very intentional. Now they're doing audits on gender-based violence with their health and care workforce, which is again really great policy. And then going to another continent, Chile, they just did constitutional reform. And in their constitution, they have now mandated having 50% and having significant women's leadership role and presence. And there were also some around the pandemic, they were able to actually get stipends for care work, and not for what I mean is care work that every woman is doing in her household. And those are some examples of policy changes recently.
Oh, fantastic. Thank you so much. Look, there have been some wonderful comments again coming through in the chat. Really just to thank you for your brilliant presentation and your inspiring words. And it's just fantastic to see the momentum, obviously, that's building now. Be fantastic to see, what happens now moving forwards. But we're going to move to the last part of the program, which is the panel discussion on the potential of women in global health Australia. And so now joining Fiona, Roopa and I, we have a panel of some extraordinary women who I will introduce because, of course, today Women in Global Health Australia is launching. And this has been established with the support from Monash partners as well as Melbourne Children's Global Health. And just to let you know briefly, the Australian network's initial focus will include enhancing Aboriginal and Torres Strait Islander women's leadership and participation in all decisions that affect Aboriginal and Torres Strait Islander health and wellbeing, connecting women leaders from the Indo-Pacific region with leaders in Australia, contributing to global initiatives of women in global health, including those that Roopa has just outlined, and of course, promoting evidence-based policy to advance women's leadership in health. So I'd like to introduce our panel now. First, Professor Jacinta Elston, who is an Aboriginal woman from Townsville in North Queensland. And Jacinta is the inaugural Pro-Vice Chancellor at Monash University, and she's the current chair of Cancer Australia's leadership group on Aboriginal and Torres Strait Islander cancer control. So welcome, Jacinta. Associate Professor Jackie Hughes is a Torres Strait Islander woman, and Jackie is the Principal Research Fellow, the Diabetes Program, Wellbeing and Preventable Chronic Diseases Division at Menzies School of Health Research and a nephrologist at the Royal Darwin Hospital. So welcome, Jackie. Professor Julie Bynes is the Victor and Lottie Smorgon Professor of Paediatrics at the University of Melbourne and Head of Clinical Nutrition at the Royal Children's Hospital, and she leads the RV3 rotavirus vaccine program at the Murdoch Children's Research Institute. And last but not least, we have Associate Professor Jackie Boyle, who is the Deputy Director of Monash Centre for Health Research and Implementation and lead of the Women's Public Health and Health Equity stream in the School of Public Health and Preventative Medicine at Monash University. So what an extraordinary group of women, in addition to, of course, Fiona and Roopa. So the panel are now going to shed light on how the Australian network will translate the aims of women in global health to our context. And so again, I would encourage people to put questions or comments into the chat as we speak to these inspiring women. I'm going to start with you first, Julie, and ask you what motivated you to become involved in Women in Global Health?
A lot of reasons, Margie, and some of it based on more than 2 decades now of working in low and middle income countries, doing research and connecting mainly with maternal and child health workers, midwives, primary healthcare, nurses and doctors in various different settings, and noting that a lot of this really integral work is done by women, and they have many, many things to pass on about improving the healthcare system, but very few of them are able to advance to be able to share that knowledge through even regional health officers and to government levels. And there's some terrific women that have voices that should be heard about how to improve healthcare systems. So working with these colleagues, being able to talk with these wonderful, inspiring people doing terrific work on the ground and helping them engage to improve their healthcare system was a key motivation. And I'll certainly, that experience has been shared with a number of people, including yourself, Margie, when we've worked in various different global health settings. So when hearing about women's in global health, thinking of all the synergies and opportunities that might provide, not only for women leaders in Australia, but also reaching out to our partners and collaborators in this region. This will be the first chapter within our our Pacific region, and we're hoping really to be able to build on this and lead some great dialogue with some of the key women and leaders within this region to address some of these issues, which are very prevalent in our region. So I'm very excited that we have this launch today. It's been a lot of time coming, and I'm very grateful. I'd like just to acknowledge everyone in the team that has been putting lots of hard yards together, in particular Jane Horton and our Secretariat, and Maddie for helping us with all the communications and getting everything up and running, and our great steering committee, Jackie Hughes, Jackie Boyle, Helena Teed, Susan Sawyer, and making today come. And I really hope that we can engage and inspire everyone here, and spread the word and become involved, become engaged. And there'll be some information on how to become engaged at the end of this session. So thank you everybody and thanks Margie for the opportunity just to
thanks, Julie. Really inspiring words, and we're so grateful for your leadership, which has been really inspiring. Just building a little bit on what Roopa said before, Julie, can you expand just briefly on what you see as some of the main challenges for women engaged in global health in low and middle income settings, especially given your experiences, particularly in Indonesia?
I think number one is being heard.
Yeah.
Being heard, raising voices, being heard, having their stories recognised as being important, critical pieces of the healthcare network and the answers to some of the really big problems that present in some of these environments.
Yeah. Thank you. I might go to Jackie Boyle now, if that's okay. Jackie, you can come off mute. And just ask you again, what motivated you to become involved in Women in Global Health, and perhaps the key role of the National Gender Equality in Health Leadership Committee, which you are co-leading with Professor Helena Teed.
So I think I've always been passionate about improving equality in health leadership. I think it's really important that it reflects society that we live in, helps us to better understand and address community need, and utilises the talent and skills of everyone equally. And as Roopa outlined before, has those broader economic and social dividends as well. I think clearly it's changed over years. My mum is a nurse, and when she was training, you couldn't get married or pregnant, or you had to leave. One of her friends had secretly married and got told she had to leave 3 weeks before she finished. And then when I'm an obstetrician gynecologist, and when I was doing my specialty training, there was no maternity leave. So, we have had some change, but also as Roopa very clearly showed in that slide, there is still, significant improvement. And, I think it's really important that we work towards that organisational change so we can improve women in health leadership and leave things better for the next generation. And I think that we can't do that as individuals. We really have to do that with collective action. And social media can be used for good, because I came across Women in Global Health on social media and, realised that they're a really strong collective group across international borders, working towards gender equality and really able to, affect change at policy and systems levels. And really liked the idea that they were inclusive of young people, focused on intersectionality and working in low and middle income countries. And I've also heard Roopa talk about, the leadership coming in many forms and meaning different things to different people, and really like that kind of philosophy. And so I reached out to them and then heard some of them speak at the Women Deliver conference. As you say, Roopa, that seems like a million miles ago when I was in Canada at that meeting. We still can't leave. And then we got simultaneously the University of Melbourne had reached out. So it's been a really lovely collaboration between the two groups, and been really fortunate to work with both Helena Teed at Monash Partners and Susan, Julie, and Jane at Melbourne Uni. It's been a real privilege. In terms of what I see us doing, I think that We need to work with individuals, organisations and policymakers from around Australia. And we really want to advocate and drive policy, system and organisational evidence-based change and really facilitate that intersectional women's leadership in health. We certainly don't, there are other groups who are doing things and we certainly don't want to replicate things, so we really want to work together with other groups. Some of those, for example, like the Australian Federation of Medical Women, Franklin Women. There's some national initiatives such as the NHMRC Advancing Women in Healthcare Leadership Program that's generating evidence to promote policy and organisational change. But I think really, and I think one of our key things is also that we really want to be active allies to the Aboriginal and Torres Strait Islander Committee and really, you know, as Fiona was saying, do some deep listening, let them determine their priorities and then really actively support to try and get those implemented. But we will only be as good as everyone who joins and those priorities are yet to be determined. So we'd really encourage everyone who wants to be involved to join because we really need to hear from everyone. So, yeah.
Thanks, Jackie. Yes, and just to say again, go ahead.
I just want to make a quick point, and that is an evidence base about why involving women and their voices is so powerful. And you touched on that, Jackie. I just want to give you an example. If we acknowledge the wisdom of the elders and the wisdom of the workers, Larapa on Galawinku is now bringing Aboriginal birthing back to Galawinku. Got to be an evidence base around that. Susan Kildare has done a randomised controlled trial to show that Aboriginal women's leadership halved the preterm birth rate. So we've got to get this. This isn't just about touchy-feely, nice having women. Get the data.
Yeah, thanks, Fiona. Brilliant.
Sorry to
and I'd really welcome comment now from Jackie and Jacinta. Thank you both for joining and to hear more about what you think the focus of the Aboriginal and Torres Strait Islander Gender Equality Health Leadership Committee will be over the next few years, and also from the two of you about why you became involved in women in global health. Maybe just Jackie, you go first.
Well, thanks very much, Margie, and thanks to everyone online today. It's really fantastic.
It's exciting.
It's just really great, and I just so I'm sitting here at Menzies School of Health Research on Larrakia Country, and I'm an appointment from my institution, and that came via invitation from Associate Professor Jackie Boyle. And I guess I wanted to acknowledge that I had a PhD supervisor, Professor Karen O'Day, and I had a good relationship with Karen. She was such an important mentor for me outside of my discipline. So back to what Fiona was saying about reading widely and knowing things widely. And I had confidence in in Karen, to allow me to have confidence in Jackie's approach. But, you know, we took a year to work out exactly what does this mean for Australia, for women in global health, for us to create leadership, gender equality leadership, and what does that mean? What does that mean for me as a Torres Strait Islander woman to be, you know, public face on that? And I definitely agree with the sentiment here that we have to work together in order to be courageous about the power and control over the agendas of Aboriginal and Torres Strait Islander health and about women's health. Yeah, so there's been definitely a settling in process about being comfortable about how we work together and about the ability to listen and to hear and to have confidence, if not comfort, about what we're wanting to achieve and how we're wanting to achieve. And I just wanted to now maybe throw the mic over to Professor Elston. And I'm just delighted to be able to work closely with her as co-chairs of this committee in the next few years, as well as our huge network. So come on, get on board and come in the network so that we can drive an agenda together.
Thanks, Jackie. Beautiful words. Jacinta, over to you. If you can come off mute. Thanks. Go ahead, Jacinta.
My internet's a little bit playing up. I hope you'll hear this. Look, I'm going to stay with what Jackie's talked about because I think, you know, partly I didn't hear all of it and I'm sure she's covered all of the points. But I'd like to start by acknowledging that I'm on the land of the Kulin Nations here in Naarm. And I'd like to acknowledge all Aboriginal and Torres Strait Islander women who are joining this conversation with us today from across the country. In particular, I know there are some outstanding and really important Aboriginal leaders, female leaders that are here on this call with us today, and I'd like to acknowledge them for their contributions. Fiona mentioned earlier and has spoken a couple of times about the importance of elders, and you know, when I think about why I have agreed to join this program of work and the committee, it's really because of Jackie Hughes. And I think it's important that, you know, there is that sense of supporting the younger emerging leaders that are coming along. And Jackie had taken on this piece of work with Jackie Boyle, and I want to be able to support her as I've been supported by a whole lot of other senior Aboriginal and Torres Strait Islander women across my career, and I've been held by them. You know, Central Australian mob talk about this construct of Kani Yinapa holding, and so I want to be able to support Jackie and her efforts. And then, you know, as the work of the Aboriginal and Torres Strait Islander Committee goes on, I want to be able to support other Aboriginal and Torres Strait Islander women who are out there on the ground, working grassroots levels as well as at senior levels for our communities. And I think that that's really the critical piece for me about what this organisation can do for us. I hope that came through. I'm going to stop talking in case it was really jumpy.
No,
but,
thank you.
Hello to everyone.
That was absolutely lovely. And again, just a shout out to everyone that you will get an email to join the Women in Global Health, and you can nominate to join one of the 3 committees that these extraordinary women represent, which, just to say again, is the National, Global and Aboriginal Torres Strait Islander Gender Equality and Health Leadership Committee. So please, everyone, get engaged. We're nearing the end, but I would like to go back to Roopa for some comments and reflections on having heard from these women.
Thank you, Margie. And I just want to say it's so nice to hear all the different ways that you are coming together, and some of the themes that really stood out is just really supporting each other, being there for each other, but also working collectively, listening and learning and adapting, and really taking the time to think about those that are not necessarily in the room here with us in this virtual room. I mean, these are all values that are women in global health values. So just to hear that this is what is bringing all of you into this space just inspires me a lot more. And I want to, you know, encourage those that are tuning in. There's so many different ways to engage in the movement, and being part of a chapter is one of the most exciting ways. But, you know that there is a global community of chapters all around the world that want to connect and learn. And there's just this is an amazing journey to be part of. So welcome to Women in Global Health Australia, and a special thanks to all of you that have been spending countless hours, in-kind hours, to have deep thought to make all of this possible and to get here a year later during a pandemic. It's really, really amazing. And I look forward to working and supporting and learning from you.
Thank you, Roopa. That's beautiful. I want to concur that as well. Honestly, the amount of work and organisation to bring this together and to have this day has been extraordinary. So it's very exciting. But Fiona, perhaps over to you for some last reflections.
Well, I'm pretty inspired. I just feel now I can just sit back and let you guys get on with it. And everyone's been so kind in their comments about me. I feel very warm to all of you. But nothing could be more important. As I said, we're not going to get a health system that's going to be effective unless the voices of women at every single level is going to be taken into account. There are going to be many men who will be scared and jealous and who will not want to relinquish. And I think that's something we need to address, and to get some, you know, really good blokes on board to help with that. I don't know. I mean, I've had a lot of that now, and you will have had it too. And somehow we have to support each other through that. But my sense is this is such an amazing movement. Roopa, I am just overwhelmed with you, and what an amazing success story already. And, you know, this isn't going to stop now. You've opened a floodgate, and if you can keep those voices coming from those women who are so disenfranchised, but who know exactly what they need to do for their communities, for their women, for their babies, for their lives, then this is going to change the world. And I just feel incredible admiration for you. And Jacinta and Jackie, it's lovely to see you again. And you are real leaders, and you have such a fantastic role to play now, along with all the others. Well, there's no excuse now. There are so many good women, there are so many good Aboriginal scholars, there is no excuse not to put those people into power. So that's fantastic, you know, that is just fantastic. So thank you so much for having me. I did feel a bit of a fraud because I'm not in global health the way you guys all are, but it's been a wonderful, wonderful session. So thank you so much for allowing me to be part of it.
Thank you, Fiona. You are an extraordinary leader and you're an inspiration to us all. So thank you for your words today. And Jacinta, I'd like to go back to you and Jackie, just again for some thoughts of some of the next steps with your group, with your committee. Have you got thoughts of some upcoming things that you'd like to be focusing on? I think
I'm hoping that it works. Otherwise, I'll let Jackie jump in. But look, I think in the first period, what we really want to do is grow the network of Aboriginal and Torres Strait Islander women who are joining the Australian chapter and signing up to work alongside Jackie and myself. We really want to map out where are some of the outstanding, and we know a lot of them, you know, they've been mentioned here today, and there are others online. Where are the outstanding Aboriginal and Torres Strait Islander women who might want to join us on this journey as mentors to others? What are the activities and the things that will support our Indigenous women in their efforts? And so trying to start to develop a sense of what the community needs and wants, and being really clear, I think, that we don't want to duplicate what else is out there. We know, as Fiona said, there's a lot of great people doing great work, and we don't want to duplicate effort. We want to complement and we want to fill some of the gaps, but we've got to figure out where those gaps are first. But I'll hand back to Jackie.
Thanks, Jacinta, and wonderful for you to call out for people to join today, because I think we've got extraordinary momentum today. So over to you, Jackie, for some thoughts.
Definitely echo what Jacinta has just said, but the other great thing that we're looking forward to do is, because we are now, through the Organisation of Women in Global Health, a community internationally, wanting to connect sovereign women of Aboriginal and Torres Strait Islander nations together, but also internationally, to sovereign women internationally about driving agendas, but also driving about gender equality and leadership in other places. And, you know, I'm really, really excited about that as well.
Fantastic. Thanks, Jackie. Julie, I'd love to go back to you for some thoughts and reflections after these, you know, comments from everyone.
Yeah, I've been a fabulous and inspirational session, and I'm really grateful for everyone for their contribution. And I'm just so glad we've made it today. We've launched an Australian chapter. We can be part of this really impressive and dynamic movement, and I hope we can contribute greatly to it. And I really once again like to call out to everyone to join, be part of this, keep watching the various information and news events that are coming through so that you can engage. And I'd also too like to, I've just put in the chat, please make a shout out to all genders. I think that we need support from everyone for this initiative if we're going to really achieve change. So I'd like to just shout out to that.
Thanks, Julie. And Jackie Boyle, some last comments?
I'm just really excited. We just really want to get as much diverse representation as possible. So really encourage everyone to join, because that will then help us to direct where we go in a way that's going to be of most benefit to women, you know, intersectionality, women across many different groups. So thanks.
Thanks, Jackie. And from me personally, having the extraordinary privilege to chair this meeting and to hear from all of you, Fiona, your incredible words, Roopa, you really have started a movement that I think that train is going down the hill and it's not stopping now. So it's so exciting. The investment, the vision, the leadership is really quite extraordinary. And I defy anyone who's been listening today to not feel inspired and to want to get involved. And obviously being part of, you know, NAIDOC Week and just having the opportunity to celebrate Aboriginal and Torres Strait Islander culture, community, country, is just, I feel like this launch couldn't be at a better time. And with your words, Jackie and Jacinta, and your leadership, and Fiona, really quite extraordinary. So I don't know if anyone else has a final comment, but I would just really like to say to everyone, please get engaged. Achieving transformative change in gender equality and women in global health leadership is really on our doorstep, and it's really an extraordinary time to get involved, I think. So thank you, everybody.
Margie, I just want to say you have chaired this so superbly well. And when I give my leadership talks, I always say, learn how to chair a meeting properly. You have demonstrated that today, but also you're a legend in your own right. And I really just want to acknowledge you.
Oh, thank you, Fiona. That's incredibly kind. I'm very humbled, I must say, for everyone today. And I know I'm going to be involved with this group and can't wait. I think I'm joining all 3 committees. But thank you, everybody, and to everyone listening online. I know we're all a bit over Zoom, but honestly, it's been just the most inspiring hour and a half. So take care, everyone. Happy NAIDOC Week, and thank you very much.
And thank you, Margie.
Thanks, Julie.
Thank
Bye,
you,
everyone.
Thank you so much. Wonderful.
Thank you.
Bye.